welcome to Medical Dialogues, your daily dose of health and medical news. I am Dr. Nandita Mohan and here are today's latest reports. Faster transmission of the Omicron virus and why third dose might be needed. The coronavirus has been a global burden since 2020. With faster mutation rates, the variants as Alpha, Delta and Omicron variants are posing a much bigger challenge on the global health. A team of researchers from the Hong Kong University have given an explanation on why the Omicron variant of the SARS-CoV-2 virus transmits much faster. They reported that the new variant multiplies 70 times faster in the bronchi than the original SARS-CoV-2 and the Delta virus. According to the authors, these are the first findings on how the Omicron variant infects the respiratory tract. Also, they found that the Omicron infection in the lung is significantly lower than the original virus, which may be an indicator of lower disease severity. They found that only 5 of the Pfizer recipients produced neutralized antibodies against this variant. This translates to a 36 to 40-fold reduction compared with the original SARS-CoV-2 virus. However, none of the recipients of the corona vaccine virus had enough antibodies to neutralize Omicron. Irregular menses may indicate underlying cardiovascular disease and diabetes. Links between menstrual disorders and metabolic conditions are often underappreciated and not considered when assessing the cardiometabolic risk in women. Menstrual cycle irregularity underpins the diagnosis of polycystic ovary syndrome, which is linked to adverse cardiometabolic profile. A group of researchers aim to assess the risk of diabetes and heart disease in women with irregular menstrual cycles and those whose cycles were regular. Irregular menses may signal the underlying cardiovascular disease and diabetes, according to the recent study which has been published in the Clinical Endocrinology Journal. The researchers concluded that having irregular menstrual cycles appears to be an early indicator for heart disease and diabetes. These findings suggest that irregular cycles among women in their 40s may be linked to adverse cardiometabolic outcomes and that these women may benefit from screening and prevention strategies as recommended by the related guidelines such as the International Evidence-Based Guidelines for the Assessment and Management of Polycystic Ovary Syndrome. FDA approves tofacitinib for treatment of active ankylosing spondylitis. Ankylosing spondylitis, a type of arthritis that causes inflammation in certain parts of the spine, affects more than 350,000 people. This disease often occurs in early adulthood and causes pain, swelling, and possibly restricted mobility. The US Food and Drug Administration has approved the supplemental new drug application tofacitinib for the treatment of adults with active ankylosing spondylitis who have had an inadequate response or intolerance to one or more tumor necrosis factor blockers. The approval of the drug for ankylosing spondylitis was based on data from a phase 3 multi-center randomized double-blind placebo-controlled trial that evaluated the efficacy and safety of tofacitinib 5 mg in patients living with active ankylosing spondylitis. Dental anxiety highly prevalent amongst pregnant women. Pregnant women may be at risk of cavities due to changes in their behavior such as eating habits. Women who have a lot of cavity-causing bacteria during pregnancy may make such women more prone to periodontal diseases and even cavities. Oral health may be considered an important part of prenatal care, given that poor oral health during pregnancy can lead to poor health outcomes for the mother as well as the baby. Access to oral care during pregnancy is important for the maintenance of optimal oral health. Dental anxiety is highly prevalent amongst pregnant women as per a recent study published in the International Dental Journal. The study concluded that dental anxiety was highly prevalent amongst pregnant women, which was significantly associated with negative dental experience, dental pain, or even discomfort, and reasons for and time since the last dental visit. Vitiligo patients have significantly increased odds of sensorineural hearing loss. Vitiligo is a condition in which the skin loses its pigment cells. This can result in discolored patches in different areas of the body, including the skin, hair, and even the mucous membranes. Some data shows that melanocytes in the auditory system are involved in the illness process. However, the link between vitiligo and sensorineural hearing loss is, however, yet unknown. A new study data published in the Journal of American Academy of Dermatology suggests a link between the sensorineural hearing loss with vitiligo. The findings point to the need of audiologic evaluation in the early detection and the management of hearing loss in such patients. Dermatologists who treat vitiligo patients on a regular basis should be aware of this potential comorbidity, and frequent hearing testing may be necessary for early detection and management. That's all for today. I shall see you tomorrow.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.